everyone, and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I am your host, Kimani Hendricks, and I'm the Multimedia Communications Coordinator for the Foundation. And today, Dr. Sabeen Lulu will be talking to us about lifestyle, health, and diet and multiple sclerosis. After the presentation, we will leave it open for your questions and comments. But meanwhile, I'll introduce Dr. Lulu. So Dr. Sabeen Lulu is the Director of Mercy Multiple Sclerosis Center and Assistant Clinical Professor of Neurology at the Mercy Medical Group, where she has been practicing in the Sacramento area since 2014. Dr. Lulu also serves as a principal investigator on multiple national and international clinical trials. Dr. Lulu completed her neurology residency program at Wayne State University in Detroit, Michigan, where she was actively involved in the care of MS patients, as well as participated in many pivotal trials with MS medications. And Dr. Lulu then completed a fellowship in both pediatric and adult onset multiple sclerosis from the University of California, San Francisco, or UCSF, as well as a master's degree in clinical research from the same university. And as always, we're pleased to have her join us to present this important topic. Dr. Sabeen, thank you for being here, and I'll turn it over to you.
Thank you, Kamani, for the introduction, and welcome everybody who's joining us. I don't think I've ever done a live stream on Facebook. I'm a little behind at the time, so at least now I'll say I did one. So one down my bucket list, I guess, that I didn't have to do anything for. So welcome everybody. Today we'll talk about multiple sclerosis, health and diet, and lifestyle changes. And so I'm having a little clip here. To start with, I'm going to go through a few slides here, just to an overview about what multiple sclerosis is. And then we'll get into the science behind what makes sense and why lifestyle and diet and the gut microbiome and all these things are important things to keep in mind. And we'll get into diet and exercise and then wrap up with everything all together. So what is multiple sclerosis? So multiple sclerosis is a chronic neurological disease. It involves the central nervous system, and the central nervous system is brain and spinal cord. An optic nerve gets in the mix there because it develops with the central nervous system. And as a result of this inflammation, we get demyelination, which means loss of myelin, and eventually neurodegeneration. Now, this is the course if you don't treat it, if you don't do anything. So if we look a little at these diagrams, one thing I'd like to point out, because I'll be referring to that throughout my presentation, is something called the blood-brain barrier. So our brain and spinal cord are considered the VIPs of our body. Nothing is allowed in or out without very special passes, and everything has to go through the blood-brain barrier. And the blood-brain barrier is actually a very complex mechanism, but it involves a blood vessel and then the brain tissue, and in between a tight layer of cells. And this is what we call the blood-brain barrier. And nothing is allowed in or out through that blood-brain barrier without very special access. So we'll talk a little bit more about the blood-brain barrier and how that is involved in the mechanism of MS. But what happens in MS is the inflamed cells, or your T or B cells, they go on and they attack the outer coating of the nerve cell, which is the myelin. And this results in inflammation. And eventually, over time, what happens is the cell could become exposed, like you see here, the nerve cell or the axon gets exposed, and this way the cell stops working or the nerve doesn't work. And that's how people with MS could end up with symptoms and relapses and inflammation. And in some situations, people are able to remyelinate, which is what happens commonly early on in relapsing forms of MS. And some people remyelinate better than others, but this is why the symptoms frequently early on in the course will get better. So an overview of what we're talking about, we went through that. An overview also of the course of MS. Now, this is, I know a little bit of a busy slide, but if you look here on the left, this is disability or how disabled how much disability a person can have, and time. And the higher it goes here, the more the disability, and it's on this view here. This is a typical course of MS in untreated disease. So we're hoping that with all the therapies that we have, we are able to change the course of the disease. And we do see that in practice. We don't yet have 20 years of data because a lot of the newer, higher efficacy treatments that we have currently available have not been around for 20 years. So we don't have a nice graph or view of what it looks like of treated disease. But in an untreated disease, the natural history is people will experience relapses, and you can see here people will have increased symptoms, and then remissions where they get better, and eventually after multiple relapses and remissions, they may not get better and they may get worse, and they can have increasing disability over time. Relapses can occur with or without symptoms, and with the arrows here, what these indicate is MRI activity, and this is why we also frequently check brain scans in between to evaluate for disease activity, even in the absence of any clinical changes. Now, a lot of things can influence this natural history, and medications are a huge factor, which we'll go over briefly today. But there are all these other factors that I'm going to focus on throughout the course of the talk today. So why is MS important? MS is important because it is the most common cause of disability in young adults after trauma. The most recent data says we have about 1 million people who are affected in the United States alone. We tend to see it more in females, and it tends to be more common in Northern European descent, but it has been reported in all races and ethnicities. Now, the age of onset typically is anywhere between 15 and 50, but if you had joined us in the very beginning, I did train in pediatric MS, which is considered extremely rare, but childhood MS can happen. And also, older age of onset of MS is also a possibility, so typically above the age of 50 or 55. MS is very costly, and it actually costs in billions. And the cost is not really just the treatment costs, but it's actually untreated MS tends to cost even more because of how much it costs the community, and it costs people their inability to contribute and work and do things where otherwise they could be more productive if they were treated. So why do people get MS? It's a $1 million question. Nobody really knows exactly of what a single reason. There is actually no known single reason why people get MS, but we do know there are multiple factors that are involved. We have the genetic predisposition, there are immune factors, and then there are the environmental factors. And you really need to have all three of those together aligned to get MS. Environmental factors are many, and some of these factors, they also all interact with one another. The thought is a lot of the risk gets determined before 15 years of age. So most people who are exposed to certain environmental factors tend to be exposed to that before for 15 years of age. And again, those include multiple factors, infectious, vitamin exposure, sun exposure. There's a lot of data that looked at the further away from the equator you are, the higher the risk of MS. But again, this association tends to happen within the first 15 years of life. So looking at environmental factors with multiple interactions, here we'll go through some of these things. But one topic I'd like to focus on is epigenetics. And this is more of a newer thought. And it's actually not only MS that can do this. I mean, if you have any disease you can think of, and MS, other inflammatory diseases, rheumatological diseases, lupus, rheumatoid arthritis, inflammatory bowel diseases, even some cancers. You can put that exact same graph and look at all of these things, and you will see this all makes sense. And some of the stuff we're talking about today, I'll focus specifically on MS, but it could apply to multiple other inflammatory or immune mediated diseases. So what is epigenetics? Epigenetics is an interaction between the environment and genetic expression. We know we're born with our genes, and we inherit genes from one generation to another. But the interesting thing is, even though we carry all the genes in one cell, not every gene in every cell is active. So for example, for many of you who may have done their genetic DNA screen and you swab the inside of your cheek and you send it for genetic testing. And even though it was your cheek, the cells that were tested actually have the full genetic material. But the cells in your cheek, for example, are programmed to only have certain things that are activated so that it's a cheek cell. Same thing for a muscle cell or a bone cell or a heart muscle or brain tissue. Um, but what happens with the environment is that the environment can interact with the gene and it can cause methylation. So methylation is basically its binding. And you can see here, for example, this is a diagram that shows possible spots where it could get methylated. And usually when a cell gets methylated, typically it gets turned off. So whether the gene at that particular spot gets methylated or not, it can turn genes on or off. So someone could have, for example, a gene to cause cancer, but they have everything, avoid all potential exposures. Smoking is a very easy example. We know lung cancer is associated with smoking, and theoretically that association can happen by smoking causing methylation, and it switches on the cancer gene, for example. So people will more likely to get cancer, lung cancer in that particular setting. But this can apply again in many different things. It could apply for the gene that causes certain immune changes, the gene that turns on hyperactive immune cells, or the genes that maybe turn off good immune cells that are protective. So all these things can interact with one another. So drugs can also epigenetically change how your body behaves, and it could be a good exposure or a negative exposure. With MS, we've really come a long way, and we've had the very first therapy in MS in the 1993, and up now we have over 20 drugs that are currently FDA approved to treat multiple sclerosis, primarily relapsing forms of multiple sclerosis. And there is one theory that sometimes these therapies also help change disease severity. And we've seen people who've had very aggressive disease once they start certain therapies, even if we don't consider them high efficacy treatments, they just completely stabilize. And one thought is, in addition to the mechanism of action of the medication, but it's also epigenetics of how the drug interacts. One thing to keep in mind on MS therapies is that just because you're on a treatment doesn't mean you don't do all the other stuff. So it's not one or the other. So the information we'll be going through today, I cannot emphasize the importance of continuing to take your therapies because these are absolutely essential to control disease activity, prevent relapses, stop brain and spinal cord lesions, and therefore slow down disability progression. There are also medications that can help with symptoms and improve quality of life. So the information we'll be going through today is not meant to be used instead of treatments, but it's supposed to be used in addition to for optimal quality of life. So let's talk about the microbiome. So what is the microbiome? The microbiome really stands for microorganisms, and that covers bacteria, fungi, and viruses. Now, the gut has its own microbiome, and about 90% of the microbiome in our bodies come from the gut. It could weigh up to 5.5 pounds of bacteria. That's a huge amount of bacteria. So it does compromise about 80% of the immune system. There's a lot of interesting facts about the gut microbiome. And for example, we know when babies are born, their guts are completely sterile and they get colonized at birth. And for many of you here who are parents or have had exposures to really young newborns, they go through periods of time when they're cramping, and commonly that's when the gut, the babies, the infants' guts are being colonized. They're unique for every individual. So everybody has their own gut print, but it's modifiable. Many things can actually change the gut microbiome. There were a lot of interesting studies that showed that if you have modified, for example, rats, and they have their guts completely sterilized with no bacteria, they would not mount an immune response. But when they go ahead and had them colonize and then they stimulate them again, they developed an immune response. So that says quite a bit about how the immune system in the gut really drives the immune response. So let's dig a little bit deeper into that. And I mentioned the blood-brain barrier. And again, we don't know a lot about the gut microbiome and how exactly it interacts with the central nervous system. But there's been a lot of theories and a lot of potential mechanisms of how this happens. So if we look at the graph here, we mentioned the blood-brain barrier and how this is extremely crucial for access for any information or any cells to go in from outside the central nervous system into the nervous system. And that again includes the brain and spinal cord. And here is your intestines or the cells in your gut. And then here are your microbiomes. And these are your little bacteria that line up these intestines. Now, a lot of these microbiomes are actually good for you. They do a lot of things. They help you absorb nutrients. They help you metabolize food. They help you also, they help bring out connections, neurotransmitters, sometimes even hormones and cytokines. Cytokines are involved in inflammation too. But this normal symbiotic relationship is extremely crucial. And in a healthy gut microbiome, everything flows smoothly and there is a balance. Everything, the bacteria does what it's supposed to do and it gets information back. And there is no inflammation. And what happens in inflammation is these tight junctions here might leak and allow either the bacteria to go through into your bloodstream or chemicals or compounds to go into your central nervous system. And therefore, that can result in inflammation in the blood-brain barrier. And that's one mechanism of how inflammation may arise in MS. Now, of course, it's not the full story, but that's one theory of how the inflammation happens. Now, if we look here, we see what we call a dysbiotic microbiome. And a dysbiotic microbiome means the balance is now a little off. So what we see here is we see a lot of these abnormal bacteria are now passing through. So now what used to be very tight junctions are now leaky, and they allow the bacteria, but something else is also allowed in, which are T cells. And these are the immune cells that mediate inflammation and disruption. One known inflammatory marker is Th17. So Th17 is a well-known inflammatory mediator in multiple sclerosis. And we know there is some association between an unbalanced gut microbiome, which promotes that dysbiotic relationship, and formation of inflammatory cytokines, which then go on into the blood-brain barrier and then go into the brain and spinal cord and cause the inflammation. Now, with medications, one of it includes disrupting the pathway of these immune cells into the blood-brain barrier, but then it also prevents some of that dysbiotic relationship and promotes a more balanced gut and CNS pathway. And it could do that by many different ways. And we saw there's more than 20 drugs, for example, in MS that we have available. Some of them may block certain inflammatory cytokines. Sometimes they promote the healthy immune cells to decrease the number of pro-inflammatory markers. So that's one theory of how the gut microbiome can interact. Well, there's a lot of other things that can also change the gut microbiome, including diet, exercise, prescription medications we mentioned, and for example, smoking or other toxic exposures. And really anything in the environment can interact with your gut microbiome and change that relationship. So let's talk a little bit more about diet. So there's tons of diets, and I'm not going to go through each and every little diet and every diet, and many people have tried different diets. Now, the interesting thing about diets is, one, it's very unique for every individual. So, for example, I remember hearing this from a tour guide when I was in Hawaii, that the native Hawaiians' bodies did not, right now they have, for example, a lot of obesity because of incorporating a Western diet, and their original diet that their bodies are made for tended to be more natural, more earth, more wheat products and things like that. So everybody, and there's always different people who would say there's certain foods they cannot digest or tolerate or causes uncomfortable GI system. So it is, the key thing here is to do what's best for you. If, for example, you are allergic to gluten, then a gluten-free diet is the best thing for you. There's no evidence that gluten is bad for MS unless you are gluten sensitive or gluten allergic. So someone else might feel like a vegan diet is the best thing for them, and that was shown to be a generally healthy diet. But if you enjoy meats and you don't have the tendency to have any irritation from certain foods, does not mean that you need to change your diet. Again, unless that does not work for you. The important thing about this slide is to recognize that changes in your diet may impact your gut microbiome and can affect your inflammatory response. So trying different diets is not a bad idea, and seeing how you feel and how your body responds to them is not a bad idea either. And again, there's tons and tons of diets, and I'm sure there's a lot more that I did not include here. There's a lot of studies that looked at certain diets and people feel better on them. But as of now, there is no single diet that is the MS diet. And again, I would emphasize that you try to find the diet that works best for you and you feel good on. So overall, a few things to keep in mind. There are some things that are known to be unhealthy. So diets that are generally very high sugar, very high fats, a lot of alcohol is considered not healthy for your nervous system. Um, but more importantly, not only would they make you not feel good, but they are known to cause medical problems, diabetes, hypertension, osteoporosis, thyroid problems, and so on. So more than just worrying about MS, but it's mostly about long-term healthy diets. It's really important to keep that in mind. Um, so some general recommendations to think about. So far, there's a lot of really good data about Mediterranean diets, which is generally low fat, high fiber, mostly natural food, which seems to have a healthy gut CNS microbiome. If you were to do fats, generally preferred fats are usually nut-based, fish, or vegetarian-based sources. So these are high-fat foods, but these are healthy fats. You do want to limit alcohol because excess alcohol, in addition to it being neurotoxic, it can actually make brain atrophy worse. And that's true with or without MS. Um, and again, if you have a known allergy or sensitivity to certain foods, you certainly want to eliminate those from your diet. But there's no evidence that a dairy-free diet, for example, is recommended for everybody with MS. Um, so what about supplements? Now, keep in mind that some supplements also may affect your gut microbiome. Now, a few things to keep in mind, and there's tons and tons of supplements available, but there are a few things that you would want to avoid. For example, you want to avoid anything that says this stimulates or activates your immune system, and that being the fact that your immune system is actually hyperactive with MS. So you really don't need anything that activates it further. Comments like these are proven studies that were shown to help MS or something else, or I see that a lot too with, for example, memory. The supplements have been shown to improve memory or help memory, for example. Anything that says this reverses MS or anything that helps everybody. These are usually exaggerated statements. Keep in mind if these were true studies, they would be FDA approved, for example. A lot of these studies are done in smaller scales. They're not monitored. They usually do small scale studies. But again, if you take a supplement and it feels good, it's okay to take it, but these are the ones to avoid. So some of these supplements, we do have some data on, and vitamin D actually has quite a bit data with MS. Interestingly, vitamin D, genetically, if we look at the genetics of vitamin D, metabolism and formation is actually along the same genes that also code for your immune cells. So theoretically, maybe vitamin D epigenetically modifies your genes to promote a better immune system. Um, there's a lot of studies that showed that when people are commonly, at the time they're diagnosed with MS, they're commonly vitamin D deficient compared to other matched age controls, meaning they take same ages for people with MS and people without MS, and it's very common that people with MS tend to have significantly lower vitamin D levels. Now, what we don't know is it a cause or is it an effect? Meaning, is your vitamin D level low because you use up more of it, maybe because it's involved in the immune system and you need more vitamin D? Or is it low and that's what is the driving response to a more hyperactive immune system? What we do know is, generally speaking, most people with vitamin D most people with MS tend to do much better with slightly higher vitamin D levels. And based on some data, generally speaking, I usually recommend levels between 55 and 70. But certainly you should talk to your doctor about what's good for you, because you could get toxic on vitamin D, and toxic levels include 90 and over. Um, so if you are on vitamin D, make sure you talk to your doctor, get your levels checked and monitored. Um, Most people with MS commonly use about 5,000 units a day. People without MS may get away with much lower doses. So again, just make sure you have that discussion with your doctor, and it's always a good idea to check your vitamin D levels. Genetically speaking, HLA-DRB1 is the one strongest genetic association with MS. This particular gene activity is influenced with vitamin D. So again, back to the epigenetics thought that vitamin D can interact with your immune system. Other supplements with some data, things like ginkgo or L-carnitine have been shown in small scale studies to help with fatigue. They're available over the counter. So if you have MS, and like 80% of people with MS also have fatigue, this is a reasonable supplement to try. They're not super effective, but they're great to try. They're over the counter and generally have very safe safety profiles. With biotin, if I was doing this 5 years ago, I would say there were data that showed biotin helps with people with primary progressive disease or to help slow down progression. More recent studies showed some conflicting evidence, and so that data is not thought to be as strong as we thought it was. If you are on biotin, you feel like it helps you, it's probably okay to continue, but the biotin doses recommended in the early MS trials were very high, of 50 milligrams, and most of the over-the-counter doses tend to be significantly lower, like 5 milligrams, I think, is what I've seen. Maybe I've recently also heard 10 milligrams. So maybe consider a lower dose, because very high doses can also be toxic. Um, Ginseng, interestingly, the data said it's not good for you if you have MS. It does raise your blood pressure, may cause insomnia, rashes, and diarrhea. But again, if you're taking ginseng, it feels good for you, it's okay, but this is what the large-scale trials have shown. Most antioxidants, anything that is labeled as an antioxidant, tends to be generally helpful. Things like green tea, coenzyme Q, alpha lipoic acid, these are all antioxidants and may be considered healthy. So a lot of, for example, nuts contain antioxidants. There's a lot of foods that may be rich in antioxidants. Broccoli, berries, a lot of the berries also have a lot of antioxidants. So these are considered good for you, generally helpful, and might be beneficial. So a lot of these supplements, again, we don't know much about very specific benefits, but the risks are not clear. But for most people, they tend to be okay. The main issue, again, some of them are very costly. So you do want to avoid taking 20 different supplements all at once, but just trying the things that seem to work best for you. So when you're looking at dietary changes, and that's one of the hardest things, and I'm sure a lot of us here today have tried a diet at some point in our lives, and whether it's for weight loss, whether it's to feel better, whether it's to just try something new. But it's actually really difficult to change our behavior based on our diet. So some of it includes, data. For example, um, I'm sure at some points one of all of us have read about how great coffee is and how healthy it is. And then 2 months later, you'd read another study that says coffee is bad for you. So there's a lot of conflicting evidence, and it depends again on so many factors. And so trying to sometimes recognize what works for you and your lifestyle is also really important. A few things that probably works for most people is trying to follow very basic guidelines like limiting portion sizes. We all know, for example, obesity is not healthy for most of us. So having a healthy body is really important. So portion sizes, healthy choices with foods, and most importantly, things that work best for you. So there are some resources, for example, meal services, certain recipes you could find online that can help you find what works best for you. And then supports, so trying to find a good support system around you. So it's really difficult when you have 4 family members and each one is on a different diet. It makes cooking really, really difficult. So trying to have a good support system, trying to agree on a diet together, and be motivated together for a healthier diet is really important. So let's talk a little bit about exercise. How does exercise modify your health system? So in general, it was found that exercise is good for your cardiovascular health. It's been shown to improve mood and mental health. It's also been shown to improve fatigue and energy levels. And I know this one a lot of people struggle with because one of the common discussions that I have is, are you exercising? And a lot of times the answer is, well, I'm too tired to exercise. I know it's a chicken and egg situation sometimes where you need to get that energy to be able to exercise. And I'll go over some tips to help you get to exercise. But just knowing that there are a lot of studies and we see that and experience that exercise actually improves fatigue and energy levels. Um, I also get this question a lot is what are good things to do to help preserve my brain? Now, unfortunately for all of us, we all start to lose brain cells after the age of 20 or 21 after a fully developed brain, which also goes on until your mid 20s. And after that, the brain volume is just decreasing every day. The only thing that has been shown to consistently preserve brain health has been exercise. So physical activity, healthy diet, and exercise have been really big factors in preserving brain health. So what are the types of exercise? So we have aerobic exercises, and these are the ones that improve cardiovascular benefits, and that could include brisk walking, if you're using machines, rowing machines, biking, cycling, um, this type of exercises that gets your heart rate up. These are cardiovascular exercises. The anaerobic exercises are those that are good for muscle mass and bone density. And this is the specific exercises that help improve muscle tone and improve muscle strength and also prevent osteoporosis because your bones need that resistance to stay healthy and get more calcium or get better calcified. Um, Stretching exercises are extremely important, especially for people with MS, because there's a lot of associated spasticity or muscle tightness. So stretching can be very gentle or can be an anaerobic type exercises. So things like yoga, for example, can be like a relaxation yoga where it's very gentle or can be quite intense. Even yoga could be both stretching, anaerobic, like your heart rate can go up. So Overall, targeted physiotherapy interventions can affect the balance performance and also decrease falls in people with MS. So this is a picture from the MS Achievement Center that we have here. We have a lot of great participants who come in once a week, and they go work with physical therapists closely. And studies show that having these targeted physical therapy for people with MS, even if they're not ambulatory, but getting these targeted exercises can be very helpful, can improve balance and decrease falls. Exercise was also shown to improve EDSS score, and EDSS stands for Expanded Disability Status Score. And this is a measure of disability in MS. So the higher the score, the higher the disability, and exercise was shown to improve those scores and walking speeds. This exercise only studied people who were on an active MS therapy. Um, Furthermore, exercise improves quality of life, disease impact, and symptom control. There's lots and lots of exercises, and a lot of these pictures are actually also from participants in the Achievement Center who also have variable levels of disability. So when we talk about exercise, it doesn't have to be someone who is very, for example, ambulatory. It could be even people who are wheelchair bound. There's a lot of exercises you can do. Water aerobics are actually really beneficial for MS because it allows you to exercise without that overheating, which is a big factor. I know is a huge limiting factor for people with MS. So some tips to think about to help you motivate yourself to develop an exercise. The most common reason why people will say I cannot exercise tends to be, well, it's too busy. I don't have the time. And while that's true, it is important to consider this a top priority in your life. Just like you would not, skip on sleep. I know some people still do, but it's important. So try to put it on your calendar, have it a scheduled time in your daily routine. It does not have to be every day. I mean, I would start with a very short time, and I'm saying here 30 minutes, 3 days a week, but does not have to start that way. Start with even shorter sessions. The key thing is to have it a regular routine that you're able to follow that works for you. Use any motivation tools you have, whether it's having an exercise buddy, whether it's developing goals to say, this is what I want to achieve at the end of the month, whether it's a reward that you're going to give yourself if you complete your exercises, but also make your goals smart and reasonable. So don't choose goals that you know you're not going to achieve. And an important thing to keep in mind is not every exercise works for everybody. People with MS have different stamina, they have different levels of performances, they have different levels of ability to tolerate certain exercises. So if something does not feel good, if something is too painful to do, or if something makes you worse, do not continue with it. Stop it and try something else. If you exercise and you notice that you're constantly overheating, maybe try to exercise in a cooler room. Maybe try water exercises because that allows your body to stay cooler. Maybe use cooling vests. We're talking about cooling vests at the beginning of this program today. Drink cooler liquids and don't go out when it's really, if your exercise is a daily walk, do not go out at the peak heat. So early morning, end of the day. And if you have a really hard time trying to find an exercise routine that works for you, you can always request and talk to your doctor about a physical therapy evaluation. And they can help you develop an exercise program that works best for you. So let's talk a little bit about disease exposure. And infections have actually come to play. A lot of people believe that infections play a huge role in developing MS and risk of MS. And EBV, or Epstein-Barr virus, is one virus that has quite a bit of data. Now, EBV is a type of virus which actually attaches to your B cells. And just like we talked about epigenetics and how epigenetics things can get turned on and off, it is postulated that possibly this is how EBV can have its effect on higher risks of MS. Now, interestingly, we know that people with MS, about 99% of people with MS who get tested for EBV will test positive. However, we also look at the general population, and if you look at everybody, 95% of the population is exposed to EBV. But MS is not in 95% of people. So there are other factors. So just like we mentioned earlier, the environment, epigenetics, immune cells, there's a lot of other factors. So EBV has other associated diseases such as Hodgkin's lymphoma, cancers, and other autoimmune diseases. Most of the time, very young children have very mild symptoms of a very mild cold. Usually for young adults or puberty, they will get symptoms of infectious mono. And one theory is that when people are exposed to Epstein-Barr virus, is that actually it can reactivate. So if you get EBV infection and as a child, let's say, and then years later you get exposed to some other virus. And interestingly, a lot of newer data on the chronic fatigue that a lot of people have seen with COVID, for example. Some people theorize that this is because of Epstein-Barr virus reactivation. Now, we don't have specific treatments for EBV reactivation, but theoretically, it is thought to increase inflammation. And for people who have MS, for example, it does increase the pro-inflammatory cells and therefore increase inflammation and relapses. There was a recent study that was published, and it was a very interesting study because it was a longitudinal data. It's 20 years long. It started in 1993, ended in 2013. It involved the US military. So if anybody here is from the military, thank you for your service. It involved more than 10 million individuals. So really huge, huge data set. They had, so they did this study on some stored serum. So when people enrolled into the military back in 1993, they took a sample and they stored it, and then eventually they tested them for EBV. Interestingly, which goes along with what we talked about 5% were negative, which again, we said 95% of the population is positive for EBV at some point. And then out of those 10 million individuals, basically they were able to collect samples. So they had to, not everybody had samples, but they had about 800 cases of MS, so people who eventually got diagnosed with MS, and they took comparable samples from people who did not have MS, about 1,500 of them. And out of the people who, so 5% of them were negative. Out of the 5% who were negative, about 900 developed MS. And then out of the ones who they had blood work for, only one out of the 801 cases they had samples for remained EBV negative, although they did carry a diagnosis of MS. So interestingly, the conclusion at that point was that developing MS, so the MS risk increased 32 folds after EBV exposure, but that association did not stand with other viruses. So they tested some other viruses within that study, and they did not see that correlation. And how long it took from the time of exposure to developing MS varied from 2 to 15 years. Um, we have known about this association with Epstein-Barr and MS for many, many years, but this was a really neat study that really looked at people who were previously negative and then how many of those did eventually develop MS. So it was a really nice, well done study that looked at that association. And again, understanding how all these viruses and infections play a role, we know that epigenetics certainly play a huge role. So we also learned a lot about pediatric MS. Why do children get MS? And it is thought to be also related to exposures to certain high risks as a really, really young age. Data did show that young children who start exposure to school or daycare at a very young age actually have lower immune diseases compared to children who start school later on in kindergarten and so on. That tells us that, and of course, we all know if we all have children at daycare, how often they get sick, and it's like almost every week they have something in their system. But that early exposure is actually really good. And another interesting fact with COVID, for example, that we learned is younger children tended to do significantly better than older adults and so on. And part of it is because at a really young age, the immune system gets shaped, and the more exposure to certain viruses, the better the immune system behaves. Now, some data suggest that the order of these infections plays a big role. So, for example, HHV6 virus can interact with EBV, and whether or not they had EBV first or HHV first changes how the immune system gets shaped. Um, Also, the gut microbiome can also have a big role to play. So, how it picks up on those infections and how those infections change the gut microbiome and therefore resulting in changes in the blood-brain barrier also can affect the immune system. So, infections have a big role to play. EBV is the one with the strongest association, but other viruses can also have a role to play. So briefly, let's talk about toxic chemicals and drugs. In general, we know there's a lot of good data about smoking in MS. The conclusion is really, if you smoke and you have MS, the best thing to do is to quit smoking, in addition to all the other health difficulties that smoking will cause. We know smoking is pro-inflammatory. It increases the inflammatory state and reduces the good T cells, the cells that help with remyelination, the cells that help decrease inflammation. It also interacts, and there's some studies that show that it can decrease the efficacy of certain therapies. And it does certainly also interact with the gut microbiome and also promotes a pro-inflammatory state. Um, Toxic exposures, we don't know much about. There's not a lot of evidence on a lot of things, but some small studies looked at air pollution, heavy metal exposure, for example, and some studies showed there is an association, but others failed to do that. So theoretically, toxins in general may promote a pro-inflammatory state by changing your gut microbiome. And of course, drug addictions in general also have a lot of health complications. but also they may also interfere with the gut microbiome and also interfere with blood flow to the brain and spinal cord, which also increases the risk of progression and inflammation. So let's talk a little bit more about the psychological state. And one thing to keep in mind is stress is not a cause of MS, but stress can actually make you more predisposed to infections and decrease good immune cells. Stress can affect your gut microbiome and make you more pro-inflammatory. And I know it's so much easier said than done, but it's really, really important to work on stress management. And it's very difficult. It's one of those things that there's a lot of factors in our lives that we have no control over, but there are things that we can control, and whatever you can do, trying to get all those resources that you can tap into, whether it's friends, whether it's colleagues, whether it's family, and try to work with you to help with stress would really, really benefit your overall immune health. We know depression has a very high prevalence in MS. At least 50% of people with MS have depression, but only 12% receive treatment. And some of it could be that the topic never comes up. I always try to make a point to ask about depression because I know it's not a comfortable discussion. Not everybody is comfortable with talking about mental health and depression. And I think that comes with years and years of stigma associated with depression and mental health. Fortunately, now we're in a much better place. There's a lot less stigma, a lot more awareness. But it is important to have that discussion with your doctor because there are medications that can help. In fact, studies showed that people with MS who have treated depression are 3 times more likely to participate in activities, twice as likely to have a healthier diet, and twice as likely to have a better quality of life. So depression is treatable. So make sure you have that discussion with your doctor. It's really important as it has huge impact on your health and your diet and how you participate in activities and how you're able to exercise and how you're able to take charge of your health. Ways to do this is to, and some people are not big fans of pharmacological treatments, which is okay. There are lots of other tools that you can utilize to treat depression. So you could consider counseling. You could look at lifestyle changes, things that you're able to change or have certain things modified in your day-to-day schedules to decrease stress and improve your depression. Medications are an option, so something that you can absolutely discuss with your doctors, having a support system, utilizing mindfulness, deep breathing, meditation, exercise as a tool to improve stress and depression. Include activities that you enjoy. Make sure, and it's very easy to get busy with day-to-day life and work and family responsibilities, make sure you include activities you enjoy and make choices. You have control. You're able to make those choices, and that includes talking to other people who are able to help you with changes at home, work, medications, exercises. So trying to tap into, again, all of these resources is really important. And saying all that, again, this is a graph of untreated MS. The hope is to change the course of your disease because you do have control over your epigenetics. So you have control of all of these factors, and there are things you cannot control, but you can epigenetically modify your trajectory with your MS. And I will stop here and I'll take any questions.
Thank you, Dr. Lulu. It looks like we have some questions already in the Q&A, but if there's anybody who's watching us through Zoom and you are unaware of how to ask questions, you have a few options. You can either use the raise hand feature, which allows you to speak directly to Dr. Lulu. If you are on a phone and you would like to raise your hand, you would press *9 to do so. And as always, we ask those who do raise their hands, please wait to be instructed to unmute yourself and then speak. But if you would prefer to just type them into the chat or Q&A boxes below, you have that ability as well. I believe in the Q&A feature, you can ask a question or leave a comment anonymously. And of course, if you're watching us from Facebook, you can just type your comments down below and then we'll get to them as soon as we can. So let me jump over into Q&A. An anonymous attendee asks, how good is commercially available gut biome testing services at improving gut health?
So, one thing I did not mention is there were studies that tried to look at, is there a certain gut microbiome that really affects MS versus others? And the conclusion was there was no specific bacteria. Now, you could do your gut microbiome testing, and that involves doing a stool sample, and testing can be done. The question here is, what do we do with this information? There's a lot of studies that are looking at that, and it's shown that it changes and modifies with changing behavior. But what is the value of understanding certain bacteria are associated with certain diseases, or is this good or bad for you? So I think right now it's mostly of interest for research. I know some people meet with certain physicians who look at this and might make recommendations on some healthy choices, which is probably okay, but I don't think that that would necessarily have significant answers or will point you towards one direction or another. So yes, these services are available. We just don't know what to do with this information. I'll go through the questions. I see some questions here. So one of them says, how does nicotine affect MS? So nicotine is also thought to be similar to smoking to promote pro-inflammatory cytokines. Now, vaping is a newer thing. I don't think we have enough data as much as smoking. I don't have a lot of information of how it affects MS. Theoretically, there are some forms of vaping that could, because I know they have certain chemicals in those products that may negatively affect your immune system. So I think we'll learn more about vaping and MS over time as more research becomes available. The other question is asking about emergency supplements. So in general, most vitamin C supplements are generally okay, and I don't see any issues with taking those. Another question is about cryotherapy and hyperbaric oxygen chambers. Now, these studies, there are people who do those. I think as of now, there has not been any convincing evidence that they are worth trying. I know a lot of people who've tried them. I've not observed any significant changes. I know they're costly, so if you have extra money to spare and you want to try them, they're probably okay to try. But I don't think the evidence has been supportive to one way or another. A comment was about Epstein-Barr virus, and it is true there are some people who have never been exposed. The theory is maybe there was a strain that does not show up on the testing, but it's unclear, because even the study did show that 1 out of the 800 individuals who had MS did not test positive. So it is known. This is why I said it's 99% of people with MS, not 100%. There's always that little outliers. So so that is also possible.
Dr. Lulu,
Yes.
Can I stop you for a second?
Sure.
To Roy, he wanted to know when the video would be available later on. Roy, you can go to the Multiple Sclerosis Foundation Facebook page. We are streaming there now. And when the live stream is over, you'll be able to watch it from the beginning in case you missed anything else. And it will also be on the YouTube channel within a week or two. I'm sorry.
Okay. There was a question on metformin. There are some data that seem to be positive, but they weren't very strong. Metformin does have a lot of side effects, and some people cannot tolerate it. But if you have other conditions that require the use of metformin, the data has been mostly reassuring. So I think by all means, it's reasonable to try. It will be difficult to try it if you don't have other conditions, just because it does drop the blood sugars quite significantly, and usually in my experience has been really poorly tolerated. Question on the gut microbiome. You can improve your gut microbiome by all the things we talked about: healthy diet, avoiding toxins, finding a diet that works best for you, taking your prescribed medications. Things like antibiotics can mess with your gut microbiome, so making sure you take probiotics. There are some healthy probiotics, and there's tons and tons of those. So again, trying to find something that works best for your body. There are other questions on specific supplements and medical marijuana use and things like that. Medical marijuana is like a whole hour talk on its own, so I won't get into it. There have been studies that showed marijuana can be beneficial for spasticity and to help people with MS sleep better. There's a lot of controversy about it, so I'm not going to get into detail. But if it does help with some of your symptoms, you can discuss that with your provider. Probiotics, I think I mentioned. So we can do probiotics. I actually encourage my patients to take probiotics. But again, some people don't tolerate them. So if you don't feel good on probiotics, I don't suggest you take it. Okay, hopefully I did not miss any questions. Did I, Kamani?
There is someone who's had their hand raised for a while.
Oh,
Her name is
yes.
Exa. Exa, if you are still there and you still would like to ask Dr. Lulu a question, please unmute and ask away. Don't know if she's there anymore. She's had her hand raised for a while. I think it was back when you were still presenting. I did message her to tell her to hold on tight, but I don't know if she's there. Can you hear us, Exa? Yeah, I don't think she's there. Do you see any questions coming in from Facebook, Flavia?
No, there are none.
Okay. Yeah, it looks like I think you've answered just about everything. Or did you cover intermittent fasting?
I did not cover intermittent fasting, but there's a lot of data that intermittent fasting is very beneficial. It promotes a healthy immune system. So I actually encourage intermittent and mostly intermittent or timed eating because fasting can vary, but usually that's actually a very beneficial tool. So the data on it has been mostly positive. So I would I think it's great.
Okay. I did actually have a question. It was about the preserving brain health. You mentioned exercise being proven the only way to preserve it. Were you referring to physical exercise? Or I think that other activities like reading or doing puzzles are things that you would think preserve brain health, but I just wanted to clear that up with you.
Yes. So rather than I maybe preserve is not the best word, but it's to promote the best brain health possible, because again, we all lose brain cells as we get older. Like aging is a factor we cannot change. Physical exercise has been the strongest indicator of good brain health for people as they age, as they get older. Mental exercises are useful, but what studies did show, for example, if you're someone who likes to do puzzles, then you help the part of your brain that does puzzles. So brain health has a lot of different functions, and exercise promotes the whole brain health. Mental activity is good, so certain constant mental engagement is good for your brain. But if you're only doing one type of mental exercise, you will get better at that particular type of mental exercise. It's not going to help the whole brain. So interestingly, data did show that mental stimulation, so learning new things, being exposed to new things is another good thing. So think of your brain as a muscle. The more you stimulate it and use it and learn and be exposed to new things, the more it gets stimulated and it stays active. So, so that's one way. So experiences are very important too.
It looks like we do have a question from Facebook from Michael. He says, what about PEA as a supplement?
Right, and I did comment on that earlier because again, specific supplements, I usually don't like to comment on specific supplements. The ones that I mentioned in my talk are the ones that have some data. I don't have an opinion just because I don't think there's enough data. So, so in general, just as long if it works for you, you can talk to your doctor about it. If it helps you, feels good, it's probably okay. But we don't have data on a lot of supplements, unfortunately.
Yeah, I did have another question. It made me think of a conversation that I had with someone a few years ago who lives with multiple sclerosis. They claimed that coming off of their treatments and changing their diet completely adjusted the way they felt and impacted them positively. And would you, I mean, I don't know if this is an ethical question to ask you, but you would not recommend anyone coming off treatment. You would prefer that they stay on treatment because, or is it just a per case situation?
So it may be possible that that particular person had side effects to the medication. We know medications can cause side effects, and for some people, being off medication will feel better, but it may not be better for them on the long run. So if a medication is causing side effects, I do recommend you discontinue, but you should have a discussion with your doctor about switching to something else that works for you, because MS can have disease activity without clinical symptoms. So even though they're feeling good, they may or may not have their disease stabilized. So these are two different things. But again, if a medication is causing side effects, then absolutely they should discontinue and think about something else that they can tolerate better.
Yeah, I think I mainly brought it up because the lady I spoke to emphasized that food was the primary reason she was feeling good. And then she came off medication because she changed her diet and was like, oh, well, I feel fine. I guess I don't need to be on DMTs and what have you. So that's more or less why I asked. But thank you for that insight. It looks like that is all the time we have for now. You did, thank you too for going over a little bit to answer everyone's questions. But if you did miss any part of this conference, as I said earlier, it will be on our Facebook page and our YouTube channel. Please follow MS Focus on Facebook, Twitter, and Instagram for times and access information. Subscribe to our YouTube channel as well. And you can visit our website, msfocus.org, to see our events calendar if you are interested in signing up for other conferences. Our next one will be after Labor Day holiday on Tuesday, September 6th at 4:30 p.m. Eastern Time with Dr. Ben Thrower, who will be discussing the immune system in MS. And I thank all of you guys for participating, whether you were on Zoom or on Facebook watching us. Thank you so much also, Dr. Lulu. It was nice to meet you, and thank you for sharing this information with us today.
Thank you, everybody, for attending, and thank you for having me today.
Awesome. Everybody, please stay safe. Take care.